And I'm telling you now, clear today, do not put garlic cloves in your vagina. Okay, good. Now that we covered that, we can talk about the treatment. Hi there, welcome back to my channel, Bingo is Kimbo. I'm Kim, also known as the Goodtoall Doctor to some, and this is episode 3 of the Vagina Demystified series. A series where we'll be talking about the norm and not so norm conditions of the vagina. The past few weeks have been super fun and full of tons of information covering the anatomy, physiology, normal vaginal discharges, and even the menstrual cycle. The time has finally come for us to talk about the not so normal part of the vagina, starting with the yeast infection and bacterial vaginosis, as the title suggests. So let's start with the yeast infection. Approximately 70% of women will experience a yeast infection. So in other words, if you don't have one already, you more than likely will get one. It's something that is completely normal and absolutely nothing to be ashamed of. Also, once you've had one, it increases your risk of having another one. So that to say, girl, if you had one, don't even worry about it. We're going to talk about it. We're going to go through it, and you're going to understand it. And your children, your auntie, your sister, your mother, everybody are going to understand when we're done, yeah? So let's get into it. So yeast infection is a fungal infection. Yes, it is a fungal infection caused by the Candida albicans fungus, thus making this infection also known as candidiasis because of the agent that causes it. As mentioned in episode 1 of this series, the vagina normally contains a bacteria known as a lactobacillus bacteria, which helps to fight off infections. It also contains just a teeny smidge bit, normally, of yeast. And you see, when the balance of the two changes, yeast then overgrows and causes an infection. This overgrowth of yeast leads to the hallmark symptoms of extreme and intense itchiness. And I mean, that is associated with most fungal infections, including ringworm and jock itch. I mean, for crying out loud, the infection has itch in it. You also have swelling to the vaginal areas due to the inflammation, and the discharge is so specific to this infection. It is usually a off-white to grayish, clumpy, thick discharge that resembles cottage cheese. Now, I'm not a fan of describing discharges and body parts with food, but I mean, it really looks like cottage cheese. Like, it has a very minimal odor that's close to like a bread-like or a cheesy-like smell. Not off-putting and foul, but it's not the same smell that you would be used to that comes from your vagina. As you know, every woman has their own particular smell, right? After all, it's not garden of roses down there, it's a vagina, so you would expect it to smell like a vagina. But when it comes to yeast infection, your normal scent is altered. All the symptoms we just discussed can lead to vaginal irritation, which then can lead to vaginal tearing, especially if you begin to scratch the areas that itch. Note, the length of time you have the infection without treating it is the worse the infection gets over time. In other words, if you make it time, it's gonna get worse. Now, any and every woman can get a yeast infection at any time, but there are some factors that predisposes you or make it more likely for you to get an infection. And the first thing, a moist groin. So either it be exercising in the gym and keeping your gym clothes on, or going to the beach, river, or even the pool and keeping your swimsuit on. That is a perfect way to grow yeast. Yeast adores, loves dark, wet, and moist environments. It's like their favorite place to be. So if you want to get a yeast infection, keep on the swimwear, keep on the gym clothes after working out. Give it an hour or two, yeah man, yeast will just come and sort it out. 2, hormonal changes. Either be a period, pregnancy, or even birth control. An alteration in the norm of hormones can affect the pH balance in the vagina, resulting in an infection. 3, uncontrolled diabetes, uncontrolled blood sugars, interchangeable. But if you want to talk about a superfood for yeast, now we're talking about sugar. If your blood sugars are not at an appropriate level or controlled, you are feeding yeast to grow, not just in the vagina, but even under the folds of skin, either be under your breast or under your arms. If you're slightly overweight, on the folds of skin on your abdomen. It's not worth it. It's very uncomfortable, and it can be prevented with proper diabetic control. 4, the use of antibiotics. Now, we discussed this quite a bit in the first episode of this series, where the lactobacillus bacteria keeps everything in order down there in the vagina. Now, without this bacteria, as you know, antibiotics targets bacteria. Despite it being a good bacteria, it's still targeted. So without this bacteria, everything down there just goes haywire, chaos. It's like going into Target with no employees and no cameras and no employer, and it's just you on and the masses. You can imagine how chaotic that would be. I mean, I wouldn't steal nothing, but hey, you get the point. 5, douches, vaginal sprays, scented soaps, aka kryptonite for Lady Lacto over here. It throws off your pH balance, and as much as you're trying to make down there smell like peaches and creams and roses, it's gonna smell not so peachy after you stifle it, and Lady Lacto dies, and you have to suffer with a yeast infection, or even worse, bacterial vaginosis, which we'll talk about later on in this video. 6, a weakened immune system. Either it be with steroids, autoimmune disorders, even HIV and diabetes. All these things weaken your immune system and weaken your ability to fight infections, either be bacterial, viral, and in this case, fungal. 7, this one now, it's a little bit tricky because sex itself doesn't give you a yeast infection because it's not a sexually transmitted infection. However, the friction and irritation secondary to sex can predispose you to getting an infection. And 8, alcohol consumption. Now, not only does alcohol lower the immune system, but it has tons of yeast and sugar. Sugar being the superfood for yeast, and yeast adding more yeast into the body, which is essentially yeast on top of yeast, which is a recipe for disaster. So there's tons of things that we can do to treat yeast infections. But what we're not going to do is put food and oils inside of the vagina. Yes, that includes garlic cloves, yogurt, tea tree oil, coconut oil, and things of that nature. They do not belong in the vagina, because then you really upset your sis. And how do I put this? It's like sending an epistle to your boyfriend and him only responding to the last message for your vagina. You get where I'm going here? It just throws her all the way off. Especially the tea tree oil and the garlic. It just erodes the delicate flesh of the vagina, just really throwing off the pH even more, predisposing you to further infections such as bacterial vaginosis. And then you have yeast infection plus bacterial vaginosis. Just a double whammy. It's just too much that could be avoided, so just don't do it. But what you can do is get one of 2 things: over-the-counter medication, prescription medication. Now, over-the-counter medications, you can get an external and an internal cream, just like prescription. But let's talk about over-the-counter first. You can either get an antifungal external cream, which belongs on the outside only, or you can get an internal antifungal anti-itch cream that goes on the inside of the vagina and can be used on the outside. Prescription medications are a lot stronger than over-the-counter medications. They contain medications more specific to Candida albicans. In addition to the external creams, which only belong on the outside of the vagina, not the inside, and the inserts such as the creams, gels, with the prescription medication, you also have oral medication that you can take, and usually it's just one pill one time and you're good to go. Now, I personally believe that, especially if it's your first time getting a yeast infection, or you find that you're having recurrent yeast infections, you really should go to your doctor and ensure that what you're experiencing is in fact a yeast infection, because there's quite a few other things that can mimic a yeast infection, such as bacterial vaginosis, which we're going to talk about shortly, sexually transmitted infections, and lastly, even allergic reactions. A lot of women are allergic to latex and they have a reaction to latex condoms. What the doctor chooses for you is dependent on your history and the preference of you and your doctor once discussing everything together. Now, I find that a lot of patients or a lot of persons are afraid of the inserts, so I thought that I would do a little mini tutorial here in this video to show you exactly how it's done. So here's the vagina and here is the applicator. Typically, you can fill the tubing with gel. The vagina is approximately 4 inches long, and that's the length of the markings here on the applicator. What you do is you insert the applicator into your vagina up to the 4-inch mark. You may or may not feel the applicator bounce against your cervix. It shouldn't hurt. And what you do is you insert the medication into the vagina. As you insert, you can pull back out. And that is it. Very simple, painless. It's a pretty small applicator, so you should be able to be okay with this. Now let's talk bacterial vaginosis, aka BV, aka the most common vaginal infection in pre-menopausal women. This vaginal infection is caused by an imbalance of the bacteria normally found in the vagina due to an imbalanced pH. This infection is characterized by its thin, watery to foamy discharge. The color can be between white and gray, with its notable fishy odor. Of note, this particular vaginitis can also be asymptomatic. So what causes BV? Essentially anything that throws off the pH of the vagina. I mean, we went through this already when we're speaking of the yeast infections, but to quickly touch on a few that are really notable here. Sex can really affect your pH balance. Either it be the genital chemistry of your partner isn't quite compatible with your vaginal flora, or the spermicides or lubrication used throws off the pH level. Most notably, semen. Semen is alkaline and the vagina is acidic, as explained in the first video. I'm telling you guys, check out the first video and the second video. Everything will be so clear in this video. But semen is alkaline, so what happens is that basic pH affects the pH. Still on the topic of sex, multiple sex partners really increase your risk of getting bacterial vaginosis. Everyone and their different chemistry affects your chemistry. It just doesn't work out for you. It's best to just either abstain completely from sex or to stick to one partner to minimize your risk of throwing off your pH balance. The treatment for BV is antibiotics, either the gel insert that I showed you guys earlier in this video or oral antibiotics. And depending on your history, whether or not you engage in unprotected sex recently, will determine whether or not your doctor would suggest to take an STD panel. Why? Because bacterial vaginosis increases your risk of contracting an STD. We'll talk all about STDs next week, but just remember that point. Okay, the part that most of you may have been waiting for, prevention. I mean, after all, prevention is a cure. There are quite a few tips I can share with you guys on how to prevent an imbalance in your pH levels. In fact, I spoke about this in depth on another video that I'll put somewhere up here. But to quickly touch on them now, let's just throw out some points for you. Number 1, cotton underwear all the time. This will do. Breathable, easy to dry, therefore very unlikely to throw off your pH balance. Other materials take a longer time to dry and also can hoard more bacteria than cotton underwear, resulting in imbalanced pH levels. Point number 2, increase your water intake. This will not only flush out your system overall, but your vagina as well, helping to keep everything balanced inside. Tip number 3, pre and probiotic dense diet will be your best friend. So your berries, your banana, your garlic, your yogurt, your coconut water, that's for you, sis. It's in your mouth, not in the vagina. Okay? Great. 4, avoid sex when you feel like something down there is wrong. Watch it for even a day just to make sure that you don't irritate the vagina anymore, because sometimes your vagina is able to overcome these things initially when it's like the initial stages and your immune system is on 100%. So avoid sex when you feel like any little thing is off. Which brings me to my next point. Keep your immune system boosted. Make sure you get enough rest. Make sure you take your vitamin C. Next point. Use antibiotics only when absolutely necessary. And a good thing to consider doing is whenever your doctor prescribes an antibiotic for you, ask them for a yeast prophylaxis. They'll know what it means. They'll know. Next point, keep things as loose as possible when it comes to your clothing. So avoid tight jeans and tight shorts. Also, use the underwear when you can occasionally when you go into bed. I mean, obviously if it's possible. If it's not appropriate, then make sure you wear your underwear. Next point, menstrual hygiene. Ensure that you, menstrual hygiene. Ensure that you change your pad minimum 6 hours, or your tampon minimum 6 hours. Ensure that you don't overdo it, because these things harbor bacteria that come out of the vagina and it's moist. Point number 7 or 8, menstrual hygiene. Minimize, change your pad every 6 hours, minimum, maximum. Point number 8 or 7. Next point, menstrual hygiene. Change your pad or your tampon minimum 6 hours. Remember, these things soak blood. Blood is moist. Moisture promotes growth of bacteria and yeast. So avoid that by changing often. Last point, minimize your alcohol intake. I know these are trying times, honey. Stress levels are at an all-time high, but replace it with water or vitamin C. Yay! Your body and your vagina will be very happy. Trust me. And that brings us to the end of the video. I really hope it was informative. Longer than I really hoped it would be, but really wanted to get this information out to you guys so that you're not afraid to go to the doctor, that you're not afraid to ask questions, and you're not sitting in ignorance or darkness, not knowing about things that happen to 70% or more of the women in this world. So if you haven't experienced any of these things, you're likely to experience them at some point in your life, and I think it's important you have some form of idea before it happens. Let me know if you found this video helpful. Until next week, Wednesday, take care, X's and O's. Bye.